Understanding measles outbreaks in daycares, health and family impacts. Imagine your child's daycare turning from a safe haven into ground zero for a highly contagious illness, measles. It's a nightmare scenario every parent hopes to avoid, yet one that's becoming alarmingly common across the United States. But here's where it gets controversial. The ripple effects of an outbreak go far beyond just immediate health concerns, sparking debates about public health, parental responsibility, and the fragile balancing act faced by American families. As measles cases surge nationwide, so does the likelihood that outbreaks will hit child care centers, settings that often include infants and toddlers too young for the measles vaccine. While the spotlight quickly falls on the urgent threat to children's health, that's only part of the story. There's an undercurrent of stress and disruption for parents, who may suddenly find themselves forced into a 3-week or even month-long quarantine, scrambling for child care alternatives and wrestling with the realities of missed work and lost income. Martha Martin, a mother in Iowa, shone a light on just how complicated this can get. After a vaccinated person tested positive for measles following a visit to her 9-month-old son's Cedar Rapids daycare, one of 7 known cases in Iowa as of mid-July, Martin took to social media to chronicle the chain reaction. Her son was too young to have received his initial dose of the MMR, measles, mumps, rubella, vaccine, so after the late notification from public health officials, the family rushed him to the emergency room for a dose of immunoglobulin, an antibody treatment recommended after exposure. The catch? The opportunity had already passed for an emergency MMR shot, most effective within 72 hours, and the couple was left unsure whether insurance or their own wallets would bear the cost. Other impacted children received their immunoglobulin shots at a clinic put together by Unity Point Health, St. Luke's Hospital, and county health authorities. Despite requests for clarity, officials would not disclose who is expected to foot the medical bill, leaving parents in financial limbo. With daycares, you have this perfect storm, explained Dr. Tina Tan, a leading pediatric infectious disease expert. There are always going to be infants who are simply too young to be vaccinated. If they get measles, the risk of severe complications skyrockets. Iowa mandates a 21-day quarantine for anyone exposed to measles who isn't immune, a standard adopted because a person can spread measles for a prolonged period. In Martin's case, the daycare stretched the exclusion to 28 days due to immunoglobulin's impact on transmission timelines. We still haven't figured out what we're supposed to do about me going to work, or my husband, or everything else, Martin admitted in a TikTok post that quickly amassed millions of views. And this is the part most people miss. The practical fallout for families doesn't stop at stress or lost wages. Martin's employer was supportive, but she burned through vacation days while her husband took unpaid leave. The experience hammered home one message for Martin, one echoed repeatedly in her posts: get your kids vaccinated. She passionately warned, by choosing not to vaccinate, you're endangering everyone around you. But is it that clear-cut? The topic of vaccination continues to trigger strong opinions, and many wonder, can mandatory policies be balanced with personal freedom? Meanwhile, these tough decisions play out across the country. For example, when a child's case of measles sparked an outbreak at a Lubbock, Texas, daycare this spring, some families were told to quarantine for 3 weeks. In a move that might stir debate, the facility tried to keep its doors open by splitting the children, sending some home, and isolating high-risk kids at the center. Catherine Wells, head of the Lubbock Health Department, revealed, sending an infant home for 21 days is a huge burden on working families. We have to balance public health precautions with parents' need for income. These challenges aren't merely operational. Ruth Friedman, a senior fellow at the Century Foundation and past federal child care director, stressed that most daycares live on razor-thin budgets. Disruptions caused by measles can push centers to the brink financially, paralleling the existential strain seen at the height of the COVID-19 pandemic. If you undermine attendance and enrollment, it can cause programs to shut down, potentially erasing child care access for entire communities, Friedman warned. Here's a flashpoint for debate. Parents angry about lengthy quarantines sometimes argue the protective measures are excessive, while others express only fear for their children's safety. Measles is no trivial infection. Serious complications can include pneumonia, brain swelling, and even death. Kids under 5 and pregnant individuals are especially at risk, with data showing about 20% of unvaccinated measles victims require hospitalization, according to the CDC. The timing of vaccination is also a subject not everyone understands. Generally, children get their first MMR shot between 12 and 15 months, followed by a booster around ages 4 to 6. However, children as young as 6 months might qualify for earlier vaccination if there's a local outbreak or if they're traveling abroad. Responding to the increased threat, Iowa health authorities are now encouraging accelerated vaccination regimens, recommending some children receive their second MMR dose just 28 days after the first. 2 shots offer about 97% protection, and with measles at its highest levels in 3 decades, the stakes couldn't be higher. But why are outbreaks happening now? Part of the answer lies in a patchwork approach to child care regulation across states, coupled with declining immunization rates in some areas. History offers cautionary tales. Late 2023 saw a Philadelphia day care outbreak ignited when a parent knowingly sent their quarantined, unvaccinated child, already exposed, to care. The result? Both child and parent ended up with measles and helped spread the virus further. Dr. Erica Hayes, an infectious disease specialist at Children's Hospital of Philadelphia, points out that measles becomes contagious before the telltale rash appears, and early symptoms can be mistaken for something as mild as a cold. So here's another controversial question. What's the right call when a working parent, facing financial and job insecurity, decides to send an exposed child to care anyway? Federal law does not guarantee paid sick leave, so many working families are caught in a bind, prioritize a child's health, or risk their own livelihood. Some states offer protections, but the trend is shifting, with some places rolling back paid leave policies despite public support. There's a relentless tension, Friedman commented, between what's best for your child, what's necessary for your work, and what's sustainable for your family, and, by extension, the health of the entire community. Let's open it up. What would you do in this situation? Should daycares have stricter closure protocols? Or do the needs of working families justify riskier policies? Does requiring MMR vaccination infringe on personal choice, or protect the greater good? Drop. Measles case confirmed in Northwest Iowa. Important travel advice. A confirmed case of measles has been reported in Northwest Iowa, and it's raising concerns about potential outbreaks in the region. This development highlights how swiftly contagious diseases can spread, even in areas where people may not expect them to. But here's where it gets intriguing. This particular case doesn't appear to be connected to any larger outbreaks or recent travel history, leaving health officials puzzled. What could this mean for public safety? Let's dive deeper into what we know so far. The Iowa Department of Health and Human Services made an official announcement on Tuesday regarding the diagnosis. The individual affected is an adult who hasn't traveled outside the state recently, which adds a layer of mystery to the situation. Typically, cases like this are linked to international travel or exposure to someone who has traveled abroad. However, no such connections have surfaced in this instance, prompting questions about how the virus might have entered the community. Health authorities are urging residents to stay vigilant because several locations in the area are now considered potential exposure sites. These include popular spots such as Super High Tech and Quick Star in Sheldon, along with Casey's General Store located on Division Street in Hull. If you visited these places recently, it's important to monitor yourself for symptoms and take necessary precautions. Measles is highly contagious, meaning even brief exposure can lead to infection if you're not vaccinated. For those unfamiliar with measles, it's caused by a virus that spreads through respiratory droplets when an infected person coughs or sneezes. Symptoms typically begin with high fever, cough, runny nose, and red eyes before progressing to the characteristic rash. Because the disease is so easily transmitted, outbreaks can escalate quickly without proper intervention. That's why vaccination remains one of the most effective tools for prevention, a point that often sparks heated debates among parents and healthcare advocates alike. And this is the part most people miss. While vaccines are widely available and recommended, pockets of undervaccinated populations still exist across the country. Could this case in Northwest Iowa serve as a wake-up call for communities to reassess their immunization rates? Or will some continue to downplay the risks associated with skipping vaccinations? It's a question worth pondering. If you're feeling uneasy after reading this, you're not alone. Contagious diseases like measles remind us just how interconnected our world truly is and how vulnerable we can be when preventive measures aren't prioritized.
So, what do you think?
Should stricter policies be implemented to ensure higher vaccination coverage? Or does personal choice outweigh public health concerns? We'd love to hear your thoughts in the comments below. Tracking measles cases in Iowa. What you need to know. Imagine a world where a single illness could unravel the fabric of your community's health and safety. That's the reality we're facing with measles in eastern Iowa. In this week's episode of your trusted local podcast, Beth Maliki and Becky Phelps dive deep into the latest measles case in the region, unraveling the seriousness of this highly contagious disease and the potential ripple effects on local health. https://www.kcrg.com/2025/07/15/after-sun-expose-measles. But here's where it gets controversial. While most people understand the dangers of measles, there's a growing debate about the best strategies to combat its spread. Should we be focusing more on education or on enforcing vaccination? The experts weigh in with their thoughts. In other news, Eastern Iowa is offering a tantalizing incentive to remote workers. A new program pays people living out of state to relocate to certain cities in the region, providing up to $5,000 to make the move. https://www.kcrg.com/2025/07/18/cedar-rapids-metro-economic-alliance-offering-500-workers-relocate. This could be a game changer for the local economy. But it also raises questions about the long-term sustainability of such programs and their impact on local communities. And as always, we're introducing a new segment this week, Hopeful Headlines. It's a refreshing change of pace, showcasing uplifting stories from Eastern Iowa that remind us of the strength and resilience of our communities.
So, what do you think?
Is offering financial incentives to remote workers a brilliant move or a short-sighted strategy? Join the conversation and let us know your thoughts. We're eager to hear your agreement or disagreement with this approach.